Hi everyone, my name is Danish and I'm a second-year psychology student here at BCU.
Hi, I'm Hannah. I'm a third-year mental health nursing student from BCU as well, and today we'll be talking about Seasonal Affective Disorder, also known as S.A.D.
S.A.D is a common type of depression that occurs during certain times of the year, typically during late fall and winter, and it's due to the less exposure to sunlight. I'll be covering about the hows and the whys.
And I'll be covering how you can deal with these symptoms and how you can cope. Have you actually ever heard of S.A.D before?
It wasn't something I was very familiar with until I came to the UK, because back home there really is no winter. It's all just summer all the time.
Wow, that is very lucky.
Yeah, so why do you think we should talk about S.A.D in terms of students?
It's definitely because a lot of students are going through a lot at university, so you'll tend to find that students are away from home, they're dealing with a lot of stress, and especially in the winter months it will obviously exacerbate those symptoms because they're already dealing with a lot.
People with S.A.D often experience the major symptoms of depression, including low energy, irritability, sadness, changes in appetite. They get excessively tired. They find it a lot more difficult to get up in bed in the morning. Individuals with S.A.D might also find themselves socially withdrawing, so they'll be less likely to hang out with their friends, mostly keep to themselves for the most part. You might find yourself craving a lot more carbohydrate-rich foods and sugary foods. After hearing some of the common symptoms, how do you think S.A.D will affect students?
Well, because of what you said, so for example, not being able to get out of bed, it can be really difficult for students to want to come into university. Here at university, especially if you're away from home, you have to make friends. Being quite irritable could probably make that quite difficult.
And I think to add on to that, the days do feel shorter, the nights are so much longer, so you just feel like you have less time in the day.
Yes.
And you just feel a lot more demotivated to do anything.
So true.
So now that we've covered what S.A.D is, let's try to understand why that happens from a psychology student's point of view. One of the more popular theories is melatonin levels and how our body produces more melatonin in response to the reduced exposure to natural sunlight.
Oh, okay, so what I understand of melatonin is that it's a hormone in the body that's released when there's darkness, which kind of gets you ready for sleep. So if there's more darkness, there's obviously going to be more melatonin, which means you're more tired, more lethargic, which obviously is a symptom of S.A.D.
We also have serotonin, which is a hormone that regulates our mood. Is serotonin something that you also cover in nursing?
It is. So a lot of the time we'll give our patients medication, and that could be SSRIs, which help the reuptake of serotonin, which can a lot of the time help their mood. From a mental health nursing perspective, a lot of the time we look at lifestyle changes. So we will try and promote patients to kind of get involved with physical exercise and eating well. And eating well is quite a big topic because, especially like you said about the symptoms, they'll go towards more carbohydrates or sugary foods, and that in turn can affect their serotonin because serotonin can also be in the gut. Loads of factors involved, and also you'll have light therapy.
Light therapy, what exactly is that?
So light therapy is basically, it emulates natural sunlight. So what we're deficient in the winter months, it can then replace that for that time. So I, funnily enough, have a light, and it's this massive, I don't even know what to call it, contraption that you just stare at for a good few minutes in the day, and it just helps with your mood.
So as a student, what type of lifestyle changes do you think I should adopt?
Definitely regular exercise. It helps to release dopamine and endorphins. You've got the healthy eating that we mentioned earlier. What do you do that helps you manage stress?
I go to the park and I read, but now that it's winter, I haven't really been able to do that as much.
Yes.
Yeah, but every day I do try to go to the gym at night. So 'cause that's the only time of the day where I'm
That is so impressive. So I was at the Yoga Society last year, and it was very helpful, very good to de-stress. I'm not gonna lie, yogas are very good for that. So the university actually does offer help with anything like this. So we have the mental health and wellbeing team that you can always contact if you ever feel like you need the support.
So BCU recently released a new app called BCU Wellbeing, where there is an AI chatbot called Charlie, where you can chat with him and ask him questions.
That's very interesting. I never knew about that, so I'm definitely going to check that out. So if you are finding that you're experiencing any of these symptoms that we've mentioned with S.A.D or anyone that you know, please consult a healthcare professional as they know best.
S.A.D is common amongst all ages, and it is a treatable condition. So with the right interventions and treatment, it is something that you can overcome.